Hey folks, retired old soldier 1987 here. Last we talked, I was in the 801st Combat Support Hospital, transferring to the 932nd FST Forward Surgical Team for mobilization. You know, one of the things I did before I even started the paperwork was, and I think it's important, I sat down with the family, my wife and my three kids, and said, okay, here's an opportunity I have. Here's what the opportunity can bring. Here's what it can do for me and for the soldiers. But it's also taken me away from you guys for a year. So tell me what you think. And I got their input. They weren't super excited about me leaving and being gone for a year, but they understood, you know, the importance of the position. They understood that it was something that was important to me. So they gave me their blessing to go. Um, so when you talk about a forward surgical team, what a lot of people don't know about them is we were a 14 or 15 soldier unit, and our job at the FST was to go into theater where there was no surgical support and provide surgical support for any patients that their injuries are affecting life, limb, or eyesight. So if they're going to lose a limb, if they're going to lose their eyesight, or if they're going to lose their life, we do their surgery, their immediate procedure right there in the field, stabilize them, and send them back to the rear. Any one of those soldiers that were, if that wasn't effective, if we could get them back to the rear, back to another hospital within theater, we would do that. So the FST is comprised of an EMT section or an ER section with one officer, three enlisted. Then the operating room section, which is where I was, again, one officer, three enlisted. And then the ICU section, again, one officer and three enlisted. And the concept was we could actually split up and we could run two FSTs at one time, and where we have an EMT, an OR, and an ICU at two different sites at the same time, and they could be run that way. And that's how, you know, these teams are set up, you know. So that's what we did. We gathered everything up, and I transferred to the 932nd Forward Surgical Team to prepare for this mobilization. Um, it's getting a little close to time here, so I'm going to cut it off here. There's definitely more to talk about, so I will. But if you like the content I'm putting out, if you like what I'm doing, hit that like button, subscribe, drop some comments down below. Let me know what your thoughts are. Let me know, you know, if you have any questions, or if you've been in an FST, hit me up with that way also. So until our next video, have a good one.